In our today's tutorial, I'll be teaching you the most commonly found test in the every laboratory and the cheapest one which will help every doctor identify your issue is called the erythrocyte sedimentation rate, also known as the ESR test. So we will be learning about it today in different ways and in a very short method. Along with that, we will also be learning the way to perform it. So what is the need of an ESR? As we all know, ESR is required for the purpose of two things or for the diagnosis of two things, and that is to identify whether you're suffering from any type of infections, along with infections to find out if you have any type of inflammation in your body. These are the two tests that helps us to these are the two things which helps us to diagnose actually what basically you're suffering from using the help of an ESR test. So infections or inflammation. What happens in an inflammation or infection and how do we get to know? As we all know, if we are suffering or any individual is suffering from any type of infection or inflammation, the red blood cells try to clump together, they start to sink. By clumping with each other, they get heavier and they sink in the tube. Because of this sinkage, it gives us a different type of rates, and that rate identifies whether we are suffering from infection or inflammation. The normal ranges that we should see for an ESR are: men below 50 years should have 0 to 15 millimeter sedimentation of red blood cells millimeter per hour. Any patient above 50 years of age should have 0 to 20 millimeter per hour. These are the normal ranges. Above them can be a sign of inflammation or infection. Similarly, the females below 50 years, 0 to 20 millimeter, we have a range 5 millimeter more than the men. Whereas the female above 50 years should have 0 to 30 millimeter per hour, the sedimentation. These are the four normal ranges for the ESR. What if the ESR is high? If you have a high ESR can only be identified or said according to one thing, and that is either you are suffering from chronic inflammations, or you're suffering from arthritis, or you're suffering from different types of infection or chronic infections. These can be the three most common or major things that can be a cause of high ESR. Low ESR indicates either you're suffering from polycythemia vera, or you're suffering from any anemia, or if there is a hemolysis of blood. These are the few things or most common things that can be identified, which will help us to say if you have a high ESR or a low ESR according to your ranges seen after the sedimentation for 1 hour period. Besides the ESR test, as a confirmatory test or any other type of test, we also have three different types of tests which will help you identify also the real cause of the infection or inflammation. Usually we test for RF factor, which is the rheumatoid factor. The RF factor just to see if you're suffering from the arthritis. Second one is to check for your CRP test, C-reactive protein, also for inflammation infection. And finally, you have the ASO test, which is anti-streptolysin O test, which also tells you if you're suffering from any infections, so that we can confirm. So these can be known as a test which can be given along with ESR as a confirmatory, so that the results can be given quickly to the doctor and the doctor can easily identify or diagnose your issue. Now, this is the whole story behind the ESR test. Let us come forward and see what are the materials required in performing our ESR test. The materials required in performing the ESR test are an EDTA sample tube, because we are using the tubes for the ESR which needs to be transferred from an EDTA tube, and this contains the sodium citrate inside, which is the anticoagulant also, including this one and this one. So all these three tubes are used for the transfer. Whereas there is one more type of tube which already can be used directly during the blood collection, and directly you can put the blood from there while collecting from the patient, so you don't have to transfer from an EDTA. So these are the three different types of companies which provide you. This is for the pediatric, this is for the adults, and we can use this one for transfer from the ESR. We need a nice holder or keeper where we can keep our the tubes, pair of gloves. So let us start doing it. After you pair the gloves, you label the patient's information or ID on the tube wherever it is, and then you just need to take your sample from the EDTA tube, nicely shooked. Open your ESR tube. Up to the marked line, which is here, you will fill the blood. So we fill the blood as such up to the marked line. That's it. We keep it aside. Close it. Shake by just twisting it or inverting it. Just 1 or 2 times you need to invert it well so that it mixes with the coagulant inside. That is the sodium citrate. After doing that, when it is completely ready as such and it has sedimentated in this form, it is down, we will take our ESR tube and push it and let the blood flow till the above line, and then leave it for 1 hour, and after 1 hour we will see the reading. If it goes below as per our normal ranges, we consider the patient from not suffering from any inflammation or infection, and if there is anything as such, then we will consider the patient is having any inflammation or infection. So we keep it straight like this at the ground level, not in the air, nothing as such, in the ground level like that. Push the tube slowly and let the blood pass, but not with too much speed. We need to push it. We need to push it slowly, otherwise the blood will overflow. So you push like that inside slowly, and then you go one by one, and you can see the blood moving upwards. This upward movement of the blood is necessary till you reach the lowest, the above count. That's it, till here. This is an indication that enough, the blood has reached. And then we will leave it without shaking anywhere in its area, so that the blood, we will see the sedimentation after 1 hour. So let us see the result. So as you can see over here, after performing the ESR test, we have seen the result as such. The final sedimentation has stopped at 90, as you can see. But then we also have to remember that the plasma sedimentation has started from 20. Because if I turn and I'll show you, there is an empty space here, which means the plasma has started to sediment from this point, not from here, whereas the blood was filled from here till here. So we can say that this much area needs to be subtracted from the total amount. So if the total amount is 90, we will remove this point, which is 20. So the final ESR value is 70 millimeter per hour, which is more or high value compared to both over 50 years of age or below 50 years of age. And we can say that the patient is suffering from any type of inflammation or infection. To confirm, we have to perform other type of confirmatory tests as mentioned in the video earlier. So this is the way to perform the ESR test and to interpret the results. Finally, thank you for watching the video.